it can be difficult to experience hair loss. An individual can go from having tasty locks on their head to having a brush brimming with strands that have dropped out very quickly or months. Typical is a sure measure of going bald. The American Academy of Dermatology states that on average, we shed 50 to 100 hair strands each day. When does it, however, become abnormal? Moreover, what are a couple of purposes behind extended speeds of going bald? Understanding the hair cycle is essential before tackling these questions. There are 4 phases of hair growth: anagen, when hair is developing effectively; catagen, shortly before hair growth ceases; telogen, when the hair stops growing; also exogen, which happens when the follicle sheds hair. The anagen phase can last between 2 and 8 years before the strand sheds. The catagen phase only lasts 2 weeks, and the telogen phase lasts about 3 months. Each hair follicle in a normal individual will go through this cycle 10 to multiple times in the course of their life. The length of the anagen, or development stage, diminishes as an individual ages, and less hair follicles stay in the anagen stage. Furthermore, not all shedding results in actual hair loss. A lot of times going bare is genuinely hair breakage. Dr. Lynn McKinley Grant, a scholarly director of dermatology at Howard School of Medicine, told Live Science, "Breakage can happen from brushing hair to a limit, or using hair stylings that draw on the scalp, like breezes around and tight networks." McKinley Grant says that using harsh products or certain styling techniques can also cause it. However, excessive hair loss can be a sign of alopecia, the medical term for hair loss. There are many different kinds, from balding caused by chemicals to problems with the immune system. The list of potential causes is enormous. According to Dr. Dan Baumgart, an anatomist and primary care physician at the University of Bristol in the United Kingdom, who assists patients with hair loss, the amount and type of baldness can be affected by diet, extreme physical or profound pressure, hormonal changes, immune system issues, certain medications, and scalp health. Frequently, a combination of these factors is at play. Telogen exhaust is a kind of alopecia where the whole scalp encounters an unexpected loss of some hair. This type of baldness can be caused by extensive medical procedures, severe cases of influenza or the coronavirus, chemotherapy, diabetes, pallor, thyroid problems, chemical variations, and many other conditions. During pregnancy, hormonal changes can stop the shedding system and begin telogen emanation in the post-pregnancy period. According to McKinley Award, when we are exhausted or generally focused, the body might prevent hair from growing if there is a limited amount of energy available at any given time. This would allow the hair to burn energy elsewhere. It's regularly not until 3.5 years sometime later, after more hair from the resting telogen stage has exited, that people will by and large see it. She expressed that this hair will commonly return. Male and female design going bald are 2 extra predominant kinds of alopecia. The first option is represented by a receding hairline, whereas the last option typically features a shrinking and expanding hair part. Depending on the concentrations of particular chemicals, any individual can experience either of these balding examples. The health of our scalps can also play a role in our hair loss. According to McKinley Award, scalp irritation, such as that caused by psoriasis, can impede hair growth but is typically treated. Less famous conditions like seborrheic dermatitis, a sort of infectious contamination, can cause disturbance too. Since this makes the scalp aggravated, a singular scratching can hurt hair follicles. Because it is easier to see, people with longer hair may be able to observe more hair shedding than people with shorter hair, for example on hairbrushes. However, McKinley Award added that seeing a more slender pigtail, round uncovered patches, or a receding hairline can be reasons to see a specialist. Related secrets. Why do the eyebrows of older men become bushier? What causes children to lose their hair? What causes hair to become dim? Skin, hair, and nails genuinely reflect your overall prosperity, McKinley Grant said, making dermatologists decisively put in a position to help with recognizing principal diseases like heart and liver issues, whiteness, and joint irritation. Blood must pass through all organs before it can reach the skin because the skin is the largest organ in the body. In this way, experts can use hair health as a useful indicator of overall health. On social media, many hair-growing products are advertised, but it's important to talk to a doctor first. Baumgart expressed, "These brands regularly advance outcomes in light of defective strategies, like utilizing patient studies as opposed to genuine science. I wouldn't do any of them until you talk to a dermatologist, McKinley Grant continued.